my name is Anna Stafford. I am a nurse with Tulare County Child Welfare Services. I'm going to be talking to my fellow nurses about medications that are administered for asthma. So we're going to talk about the disease process of asthma. It's a chronic disease where the bronchioles become constricted because of inflammation, which elicits an immune response, which you will see shortness of breath, possible tightness in the chest, wheezing. I will produce some mucus, and possibly a dry cough. Some of the causes of asthma will be, especially in Central California, pollen or allergens that might be in the air, including smog or just dust and dirt. Another cause of asthma is exercise. Stress can induce asthma, as well as lung infections. And if asthma is left untreated, it can have airway changes called remodeling, and if left untreated for long periods of time can even cause death. One of the medications that we're going to talk about is albuterol. It's a short-acting beta agonist. The mode of action is that it relaxes the smooth muscles and reduces the bronchospasms. It has interactions with beta blockers. You can see those, digoxin, diuretics such as Lasix, epinephrine, antidepressants, and MAOIs. And you should let your doctor know what over-the-counter medications you're taking for colds. It is effective. It's a rapid drug that is onset in 5 to 30 minutes, and it lasts about 4 to 6 hours. It is a rescue. It is to not be used alone. It needs a long-acting medication along with it, so that you can have the rescue effect, and then the long-acting, which is the next one that we're going to talk about, will produce the long-acting effect. The safety or adverse effects from albuterol is tachycardia, hyperglycemia, hypokalemia, hypomagnesemia. You might see skeletal muscle tremors, very common headaches, nausea, vomiting, and some kiddos especially get anxiety. The cost is relatively cost effective. It's anywhere from $44.99 to $59.59 for 200 puffs in one inhaler. And the expected outcome for albuterol is a rapid improvement of breathing due to a reduction in smooth muscle constriction. The next one is fluticasone, and I probably said it wrong, but that's okay. It's inhaled corticosteroid, and the mode of action is to reduce the airway inflammation. The other, albuterol doesn't have any inflammatory properties, but this is the one that reduces the inflammation and inhibits the inflammatory cytokines and produces long-term control of asthma. It has interactions with antidepressants, antibiotics, HIV drugs, as well as oral steroids, Tagamet, and other heart medications. Proper administration, as well as albuterol, is the key, and this one may take up to 2 weeks to be completely effective, and children should use a spacer for proper administration as well as for albuterol. Severe interactions could be anaphylaxis, and with long-term use you might see glaucoma, cataracts, immunosuppression, for kids, growth suppression, and adrenal suppression. Common reactions are headache, nasal bleeding, nausea, vomiting, cough, and dizziness. And you should inform your doctor if you already have glaucoma, cataracts, recurring infections, allergies, tuberculosis, or liver disease. It is relatively cost effective at about $50 for 120 puffs, and you should see your expected outcome should be a reduction in the inflammation over the long term to help you control your asthma. Thank you for coming to class today, and if you have any questions, just let me know.